Jim, we're all set here. Can we get started? We're getting behind now.
I know we're really late, and I have a 4 o'clock tee off time as well.
Dr. Smith, I'm really sorry I'm late. I've been up on the floor. I've been all over the place. I just got down here.
Dr. Jones, you know you should have been in the room before the patient. You should have been prepping him. You should have been draping him, not me.
I know, I'm sorry. I'm also on call, and I've been, it's just...
You know what? Just get scrubbed, please. Go.
Okay.
So, have you had a chance to review the case?
Well, no, I haven't had much of a chance to check. I was on the ER, Dr. Senior. I know it's an orchiectomy.
Okay, well, which side and how old is the patient?
Well, I hadn't had a chance to review this particular case.
You know what? We're really behind, and I was trying to stall for you so you can do this case. Have you ever seen an orchiectomy or even assisted at one before?
I did see one when I was in my first year of residency, but I was out in the community and it was all small cases.
Okay, well, let's go through the basics quickly. What's the most important thing you have to know about these cases?
I guess the patient's age, tumor stage.
You guess? Come on, what's the most important thing you have to know about these cases?
Well, first you would do allergies to medications.
Dr. Jones, that you should know in the clinic. You have to know the correct side you're operating on. The correct side, you'll be surgically removing the testicle. If you've been prepared, you would have known this. You would have done the pre-briefing, you would have done the marking of the patient, and you would have known the history. Do you know the history on this kid? He's a 31-year-old boy that's found to have an evaluation of tumor during his infertility. God forbid, can you imagine taking out the wrong testicle?
Well, I thought that when they were in day surgery before they came to us down here, they marked the side for us.
Once again, it starts with you. You should have been marking the patient, and then the nurses check that. There's a system here, so we prevent errors.
Okay, all right.
Okay, well, Aiden, do you know what incision we're supposed to make here?
Well, wouldn't you make the initial incision over the linguinal ligament, similar to a linguinal herniorrhaphy, and using the landmarks of the anterior superior iliac spine and the pubic symphysis?
Excellent. Dr. Jones, did you know that? Obviously not. What about the layers? You know what layers you're supposed to go through here?
Well, after the initial incision, you should be using the electrocautery to go through the subcutaneous fat, and then the scissors for the external oblique fascia, and then carefully isolate the spermatic cord.
That's excellent. And Dr. Jones, what are the 2 most important things post-op that we have to keep in mind?
Well, I guess you would look for scrotal hematoma and retroperitoneal bleeding. And tumor markers?
Okay, well, that's pretty good. But Aiden, you've earned the right to assist me here today. Nurse, scalpel to Aiden and retractors to me.